812, welcome back. As we head into summer, hotter weather brings the opportunity for more outdoor activities, but also increases the risk for skin issues. Joining us this morning is Dr. Abby Degasis from Mayo Clinic to talk more about common summer skin issues and what we can do to protect ourselves. Good morning. Thank you so much for coming on the show.
Good morning. Thank you for having me.
Absolutely. You know, many of us have experienced a sunburn, what it feels like, but what is a sunburn? What does it do to our skin?
We know that sunburns are the result of cellular and molecular changes in the skin in response to damaging ultraviolet radiation from the sun. We also know that sunburns can peak about 6 to 24 hours after you've been in the sunny environment. So you may not realize the extent to which you've been burned until you've left your sunny environment.
Is this one of the top skin issues during summer months?
Sunburn's definitely a top issue during summer months, but it can affect people year-round, of course.
And I know this weekend a lot of people are looking at the weather very closely. People are off. They have outdoor plans. Danielle, our meteorologist, has been talking all morning long about although it's cloudy, you still have to wear your SPF because you can get a burn within 15 minutes.
That's true. Even if it's cloudy outside, you can still be exposed to damaging ultraviolet radiation. So we recommend that you wear an SPF. The American Academy of Dermatology recommends a broad spectrum sunscreen with an SPF of 30 or greater. And it's recommended that you reapply your sunscreen about every 2 hours, sooner if you've been swimming or sweating. And most people don't apply enough sunscreen. It's a major pitfall, I think, for patients. You should be applying about 1 ounce of sunscreen per application. That's about enough to fill a shot glass.
Last weekend on the morning show, we put into perspective how much that really takes when it comes to application of sunscreen. It was fascinating to put that into perspective and talk about the shots. When we also look at SPF, should we be mindful of the dates on the bottles?
Yes, you should. Sunscreens can actually expire, so it's important to look at the expiration date. They're present on all your sunscreen bottles prior to application to ensure that you're getting adequate protection.
When we talk about sunscreen and why it's so important to wear it when outside, what role does sunburns play when it comes to skin cancer?
Sunburns and really just cumulative sun exposure over time put us at risk for developing skin cancers due to DNA damage induced from the ultraviolet radiation from the sun.
And there are different types of skin cancer. What should people look out for when examining their body?
Great question. Dermatologists think about skin cancers as 2 main categories, non-melanoma skin cancers and melanoma skin cancers. For the non-melanoma skin cancers, we typically see a red or scaly bump that's not going away or enlarging in size, and oftentimes it's tender or bleeding. And for melanomas, while there can be amelanotic variants, we typically tell patients to look for an atypical pigmented lesion. We teach our patients the A, B, C, D, E's of melanoma. I'm sure you've heard this before. A is for asymmetry, or a mole that's not perfectly symmetrical. B is for border. You want a nice, clean, crisp border to your moles, not hazy or scalloped. C is for color. You want a nice homogeneous color across your moles, not multiple different colors or color variegation in a single lesion. Diameter is referring to moles being less than 6 millimeters or that of a pencil eraser. And then the E we've added on for evolution. So any moles or pigmented lesions that are changing over time should be evaluated by a dermatologist.
I usually go to the derm every 6 months, and so I'm very familiar with the ABCs. And I've noticed as I've gone, they've added a few extra letters to that process.
That's right. I think the E is for the evolution, and that just helps patients recognize their own skin lesions that may be changing over time, which can be an indication that we need to take a look and potentially do a skin biopsy.
Changes are so vital. Thank you so much for joining us this morning. We really appreciate it.